NCLEX review on cirrhosis in 3 minutes. So to understand cirrhosis, we need to understand what our liver does and where it's at. Remember that it's in the right upper quadrant. Our liver is the largest organ and it is a very vascular organ. Super important to remember that. So anatomy and physiology, our liver produces ABC, albumin, produces bile, and produces coagulation factors. So that's why we're always going to have a risk for bleeding when our patient has cirrhosis. It also helps to decrease ammonia levels, and ammonia is a protein waste. It also helps with drug metabolism, and it stores glycogen. Albumin loves to attract extra water, drugs, and calcium. Important to remember. So if your albumin is low because your liver's not working properly, our calcium is also going to be low. Bile carries excess cholesterol, bilirubin to the bowels, but if our liver's not working, guess what? We want our patient to have a diet low in cholesterol or low in fat. So pathophysiology, you can remember cirrhosis, sclerosis, healthy liver cells are being replaced by hard scar tissue. So the causes are alcohol abuse, chronic hepatitis, cystic fibrosis. So because of elevated bilirubin levels, we're going to see jaundice, which is yellowing of the skin and sclera. We may have portal hypertension, so blood starts flowing back up since our portal vein is actually bringing blood to our liver. So we're going to have a lot of excess fluid. This excess fluid is normally going to back up into our abdomen, and this is called ascites. If your patient has ascites, they may need a paracentesis to pull off that extra fluid. If they do have it, they're going to be anorexic. They're not going to want to eat much. We may also have esophageal varices because of this portal hypertension. So one thing to remember, because they can rupture and those veins are just getting bigger and bigger, we don't want to put an NG tube into our patient and we don't want to have them strain when they're having a bowel movement. If those esophageal varices do rupture and our patient is throwing up blood, think ABCs. I want to protect that airway. I want to check their vital signs. And I want to put them in a side-lying position if they are vomiting that blood. Obviously, you don't want them to aspirate. Because our ammonia levels start growing and growing higher because of that protein waste, we may see hepatic encephalopathy. So hepatic is liver, encephalo means brain. So what's happening here is our patient's becoming altered, very confused. We may also see asterixis, twitching extremities. So you want to have them extend their arms to see if you can observe that. Because our labs are going to be elevated ammonia, elevated bilirubin. So lab-wise, we're going to have elevated ammonia, elevated bilirubin or dead red blood cells. Our coagulation panels are going to be increased, or high PT-INR or APTT, and elevated liver function test, or elevated ALT and AST. Because our albumin is going to be low, because our liver is not producing it, we may also see low calcium. Because remember up here, we talked about our albumin attracting extra water, drugs, and calcium. So we may want to give lactulose in order to drop that ammonia level. Neomycin, IV albumin, and IV albumin is important because our patient may have ascites. All of this extra fluid is hanging out, not within the vessels. So albumin helps to pull that extra fluid back into the intravascular space. Because of portal hypertension, patient may be on a beta blocker like propranolol. Octreotide, if the patient has varices and we want to cause hemostasis, they may receive that. If the patient has really bad ascites, we talked about a paracentesis to pull that extra fluid off of their abdomen. If they're going for a liver biopsy because they're trying to see what in the world, why do you have cirrhosis, then you want to remember to put your patient on the right side. Our liver's on the right upper quadrant, so you're going to have the patient lie on their right side since it's a vascular organ, and the biggest thing is risk for bleeding. Let me know what else you want me to cover and save for later.